Okay.
So now,
Interesting.
uh, so this is tissue taken out of the sinus. This is this tissue right here. That little white spot indicates it's most likely fungus because fungus secretes calcium salt when it metabolizes food. And so we clean all that out. This is what we get. And that has mycotoxins in it, just like we talked about. And so this is a normal piece of tissue in a patient who doesn't have a mold issue. And you see it doesn't have any mycotoxins coming out of the tissue. So this is the control. There's no brown stuff coming out on these patients. And this one has that. So, and this is the called cyclone. This is what we put inside the sinus that does a 360 irrigation and sucks at the same time. And that's what makes this work. After you open the sinus, you have to wash it out. And
So that's what it looks like.
this is a high pressure device. It'll show you in the next picture what it looks like. See how this is how fast it sucks. So none of the toxins go in the system when you clean it out. And this you put this under high pressure, so it's like a pressure washer inside the sinus. And so it gets rid of all the stuff inside the sinus. And this is what it looks like in surgery. So,
You're sucking it out.
well, you're irrigating it at the same time. So you're irrigating all that tissue. And this is before, and this is just what a face looks like before and after. This is like a month later. This is kind of a dramatic facial change. See?
Hmm. Yeah.
And this now this is a recent one. The reason I'm showing this CT scan is totally normal. There's nothing wrong with this CT scan, but the patient wasn't getting any better, and they were in a safe environment. They weren't, and their diet was perfect. So those are the patients that need surgery. So we had to operate on her. What has been your experience after your mold exposure?
Um, Very life-changing quality of life. Before I started, my cognition score was probably like 1 to 5. It could be lower on some days. A lot of days I was very confused. I had a lot of pain, a lot of tingling sensation in my face. I couldn't bend over. Um, just the quality of my life was not. I'd say out of a score out of a 10, it was about like a 4, 3 or 4. Today, a week after surgery, I mean, I have definitely improved. My mental clarity after I woke up after surgery was completely different. I haven't felt that in years. My energy is coming back. My brain's coming back. My brain fog has almost completely disappeared. My memory's coming back. My vision, and most importantly, like the pain in the center of my head is no longer there. That's something I didn't think I would ever get rid of. That was causing a lot of the pain and the pressure. But it's pretty much completely gone, and I'm completely satisfied with the surgery. I wouldn't change it.
Oh,
Okay. So this is 3 weeks post-op. What is your experience?
Well, before my surgery, I had a bunch of floaters floating around my eyes, and my vision was, pretty blurry and sort of discolored. And post-surgery, my floaters are gone, and my vision is kind of a lot clearer. My energy level is now a 7 instead of a 3 before surgery, and my brain function was a 3, and now it's a 7, gradually getting better.